Let's talk about total knee and total hip replacement. Look, there's no way you can say it's always going to take 2 months or 3 months or 4 months. But what's sort of the average here on how long PT lasts?
The average is about 3 months, usually about more or less 24 sessions. We usually start a patient off with 3 times a week for the first month, 4 weeks. So that would be your first 12 sessions. And the reason is we want to restore normal blood and lymphatic flow in the area, and we want to really work on getting your range of motion back as quickly and as safely as possible.
All right.
Then
now,
for the second
sorry,
month,
go ahead.
sorry,
No, it's okay.
we'll drop you down to maybe twice a week for another month, 8 more visits, and then that third month, drop you down to 1 time a week when you're more independent with your exercises. That gives you your 3 months, 24 visits. Some patients take a little longer, some patients go a little faster, but on average, 3 months.
And you still have to once again base it on the individual, the surgery, the health of the individual, how much time they're willing to put into. There's so many different things that have to go into play here. 3 months is the average. Don't be surprised if it's going to take a little bit longer, because that's just the way the body works.
Yes, yes. Usually your therapist will kind of have conversations with you as to how things are going. They might tell you you're right on target, just as we expected, or this is maybe going a little slower, but that's okay because of, reason number A or B or C, or wow, you're really going fast. I think we're going to be able to get this done more quickly. So it shouldn't be a surprise to you if things are going slower or faster. Your therapist should kind of, keep talking to you about that along the way.